Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care, so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of my clients, and the question in last week's episode was, my mum crashed and the ICU put her back on the breathing tube. Will dialysis help her to get the fluids off the lungs? You can check out last week's question by clicking on the link below this video. And if you are watching this on YouTube, just click on the link below this video. That'll get you to our website and to all the other questions answered and other free resources. In this week's episode of Your Questions Answered, I want to answer another question that we get asked quite frequently from our readers, but where we also believe our readers don't know enough about the topic in general, because we are finding that not all intensive care units are transparent about the options for some irreversible forms of heart failure and lung failure. So the question this week is, can ECMO be a bridge to a heart transplant or a lung transplant? Now, first off, if you are watching this topic in this video and you are wondering what ECMO stands for, don't worry, we'll get to all of that in a moment. Given that you are here on this blog and video, I must assume that you have a loved one in intensive care with some form of major and also irreversible lung failure or heart failure, and you are looking for a solution to this life-threatening situation. And first of all, give yourself a pat on your back for doing that. The reality is that 99% of families in intensive care don't know what to do. They don't do their own research. They don't question. And they continue to be intimidated by the intensive care team, who holds all the cards if you don't question and if you don't do your own research. With all of that said, therefore 99% of families in intensive care don't make any informed decisions. They don't have peace of mind, control, power, or influence. And I can't tell you how many families in intensive care come to us when it's too late. They come when we can't help them anymore because their loved one has already passed away or is at point of no return. It is extremely sad, and it's a sign that most families in intensive care underestimate the gravity of having a loved one critically ill in intensive care. If your loved one is in intensive care, you and your family are in a once-in-a-lifetime situation that you simply can't afford to get wrong. One of the reasons I decided to answer this question, can ECMO be a bridge to a heart or a lung transplant, is that many families in intensive care come to us and they tell us that they have a loved one in intensive care with some form of irreversible heart or lung failure. And therefore, the intensive care team has told them that it's, quote unquote, in the best interest for their critically ill loved one to die. And again, if you are like 99% of the families of critically ill patients in intensive care, you again would have just nodded the death sentence of your loved one off without questioning and without doing your own research. The quality of your questions will determine the outcomes, and it will also determine the level of informed decisions you can make. It will determine the level of peace of mind, control, power, and influence you will have as well. You must always question, because otherwise the intensive care team will drive their agenda. Their agenda is often driven by their bed and staff availability, by their financial budgets, by the politics, or by their medical research interests. So let's assume your critically ill loved one is in intensive care with one of the following respiratory or heart conditions, like ARDS, which is lung failure, COPD, which stands for chronic obstructive pulmonary disease, cystic fibrosis, idiopathic pulmonary fibrosis, interstitial lung disease, primary pulmonary hypertension, and also previous lung transplant. The heart conditions would be cardiomyopathy, general heart failure, cardiogenic shock, heart attack, ejection fraction less than 30%, previous heart transplant, recurring ventricular arrhythmias, or VAD insertion. VAD stands for ventricular assist device. Therefore, if your loved one has been admitted to intensive care and is in one of the situations I mentioned before, and the intensive care team is suggesting that the only option for your loved one is to die, you should consider your options, and you need to start asking some serious questions, and you need to start asking them fast. Again, the biggest challenge for families in intensive care is that you don't know what you don't know. Another challenge is that most ICUs don't have ECMO available as a therapy option. So what is ECMO? ECMO stands for extracorporeal membrane oxygenation, and you can find out more detailed information about ECMO on our website, and I'll put a link again below this video in the written version of this blog to ECMO, where we have all the information about ECMO available. So there are two major forms of ECMO. One is VV ECMO for all forms of lung failure, and VA ECMO for all forms of heart failure. In essence, VV ECMO can take over the function of the lungs for a period of time, and VA ECMO can take over the function of the heart for a period of time. VV ECMO for end-stage lung diseases can be used as a bridge to a lung transplant, and VA ECMO for all forms of end-stage heart diseases can be used for a bridge to either a heart transplant or to a VAD. Again, a VAD is a ventricular assist device and can take over the function of the ventricle of the heart for a period of time. And again, it can be used as a bridge to a heart transplant. VA ECMO for heart failure and end-stage heart disease can lead to a heart transplant, but it can also be used for a VAD, ventricular assist device, and that can be used as a bridge to a heart transplant. With a VAD, patients often can go home and await a heart transplant. Why do most ICUs don't have ECMO available, and why don't they tell you about the option if they don't have ECMO available? First off, ECMO is a highly specialized therapy form that takes special training for doctors, nurses, and perfusionists, and it also takes expensive equipment such as the ECMO machine. Even big ECMO centers in big metropolitan ICUs only have a few machines and a few staff members available who are specialized to look after patients on ECMO. Especially in cases of VA ECMO bridging to VAD or heart transplant, ICU staff also need to be trained to look after a VAD. Again, you need to ask, and again, the quality of your questions will determine the quality of outcomes you will get for your loved one. To give you some examples and case studies, what could go wrong if you don't start asking the right questions, have a look at this case study from one of our clients here. And I'll put a link again below this video. The case study is, my 57-year-old dad has been in ICU with cardiomyopathy and pneumonia for 5 weeks. He's still in an induced coma and still doesn't have a tracheostomy help. This case study in particular illustrates what can go wrong when patients in intensive care get the wrong treatment and are not being referred to ECMO centers with a view of a heart transplant. On the other hand, we also have some case studies from some of our other clients that will illustrate what ECMO can do for lung failure patients even without a bridge to a lung transplant. In clinical practice, however, I have looked after quite a few patients on VV ECMO for lung failure, and ECMO was the vehicle that was used to buy those patients time to receive a lung transplant. I have also put some case studies from some of our other clients, and you can see how they managed to get their loved ones through this ordeal while they were being on ECMO. While they were being managed on ECMO, and you can see actually how we managed to help them and their loved ones to get through this ordeal with guidance, consulting, and also advocacy. And again, I put some links below this video in the written version of this blog to those case studies. Number one is, my auntie is in ICU and ECMO for lung failure. We are very worried she may die. Help. And the other case study is, my mum has been in ICU for 3 weeks now and she's on ECMO for lung failure. Will she survive? So go and check out those case studies. The bottom line is this: whenever you are in a situation where your loved one is in intensive care with some form of end-stage heart or lung failure, and you are being told that there are no other options, chances are the intensive care team may have gotten it wrong, or they are simply not open and transparent with you and your family. Again, the quality of your questions will determine the outcomes and the results you will be getting. Doesn't matter what the intensive care team says. All that matters is how you respond. As you may be aware by now, not asking the right questions when you have a loved one in intensive care could be the difference between life and death. So how do I know? Well, after having worked in intensive care for nearly 20 years in 3 different countries, where I literally looked after thousands of critically ill patients and their families, I have seen my fair share of ICU patients, the outcomes, the politics, the dynamics, the psychology in intensive care, and I know the ICU team's communication strategies inside out. I have also worked as a nurse unit manager in intensive care for over 5 years. And now, since 2013, I have consulted and advocated for hundreds of families in intensive care all over the world. And I know how to get results for your family in intensive care through advocacy, through asking the right questions, and because I understand the politics and the dynamics in intensive care inside out. Furthermore, coming back to heart and lung transplant again, please also note that ECMO can sometimes be used after heart transplant or after lung transplant, especially when patients are very unstable after heart or lung transplant. There's also another article and video that I would recommend that you may want to have a look at, and it says, how long can a critically ill patient stay on ECMO? Again, if you're watching this on YouTube, it's best if you click on the link below this video. That'll get you to our website where you have access to all of the other free resources. So in the next episode of Your Questions Answered, we'll continue with a series of consulting and advocacy questions for my client Sharon. It'll come out in a few days. Keep an eye on it. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care? You will get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn quickly how to make informed decisions, get peace of mind, real power, and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind the scenes insight so that you know and understand what is really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also have a look at our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site intensivecaresupport.org for families of critically ill patients in intensive care. Or you can call me, find international phone numbers on the top of the website. Also, have a look at our ebook section, and you can also get one-on-one consulting and advocacy with me via Skype, over the phone, or via email by clicking on the relevant tabs. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.